Community Health Worker Training, Cardiovascular Health and Diabetes, Module 4C, Atrial Fibrillation. Learning outcomes for this mini-module. Explain the stroke risk from AFib. Become familiar with procedures for diagnosing and treating AFib. Identify community health worker activities that create care connections for people with a history of AFib. Diagnosis and treatment. If AFib is not treated effectively, the heart has to work harder over a long period of time, and that can lead to enlargement of the heart. That, in turn, can lead to heart failure, which we learned about in the last module. Unless it is carefully treated, AFib also increases the risk of stroke by 500%. That's because the uncoordinated pumping of the heart increases the risk of clots forming within the chambers of the heart. Those clots can then travel to the brain, causing a stroke. That's why one of the treatments for AFib is blood thinning medicine to try to prevent clot formation. There are several different treatments for AFib. Treatment includes medication pretty much all the time. It may also require surgery for some people, or cardioversion, which is that picture on the right showing them shocking the heart. And for some people, they need a combination of one or more of these treatments. So let's talk about them in a little more detail. There's a number of different medications that are used for treating AFib. So typically the person will be put on a medicine to help control the heart rhythm, so to get rid of the arrhythmia. They will also be put on medication to try to control the heart rate. So remember that most people with AFib, their heart is racing. It's going too fast. So they're going to be put on a medicine to try to slow it down into a normal rate. And they'll be put on a medicine to help prevent blood clots so that they can lower that risk of stroke. Some of the medicines to prevent blood clots are a little bit tricky, and you have to do some teaching with patients who are on these. Some of the newer blood thinners are not quite as tricky, but the most common blood thinner that people with AFib are still on is something called warfarin, and the brand name is Coumadin. And if you have a client who's on this, there's some important things that they need to know. So they're going to have to go in for lab work very regularly. And it's just a blood test, but it's a blood test to check their clotting times. And depending on the result, the doctor may increase or decrease the dose of the warfarin that they need to take. If the dose is too high for them, it can cause abnormal bleeding. And if the dose is too low, it's not going to protect them against the blood clots forming, so it's not going to protect them against stroke. And for many people, that warfarin dose has to be kind of constantly adapted, right? So it's not like they find the right dose and that's it for the rest of their lives. It often has to be changed pretty frequently, and that can be frustrating for people. In addition to that, if people forget a dose, they should call the doctor or nurse for advice on what to do next. They shouldn't just double up on the next dose because that may actually be too much for their body. They should report any unusual bruising or bleeding to the doctor or their nurse. They should tell the doctor all their medicines before starting any new medicine or before having treatment that could cause bleeding, such as surgery or having a tooth pulled. In some cases, if they know that they're going to have surgery, the doctor will have them go off of their blood thinner for a few days beforehand. And in addition, they need to limit the amount of certain green vegetables that they're eating, such as broccoli, cabbage, lettuce, spinach, kale, a lot of those dark leafy greens, because those are all high in vitamin K. And eating too many of those vegetables actually interferes with warfarin working to prevent blood clots. Other treatment options in addition may include cardioversion. So sometimes if the AFib is just going on for quite a long time, they need to actually shock the person. And you can see that picture on the left. And usually that's just a one-time thing, and it can sometimes knock the heart back into a normal rhythm. It can put that kind of electrical system of the heart that's going a little crazy back into a normal rhythm. There's a minor surgical procedure called ablation, which actually zaps or burns one area of the heart where those electrical signals start from. And sometimes if there's what they call a ectopic node, which means that there's an extra place that's generating those electrical signals that's not supposed to be. Sometimes they'll kind of zap it with heat or with cold cryo to try to get that tissue to stop misbehaving, essentially, so that the normal places where the electrical signal is supposed to come from can take back over and do their job properly. Some people with AFib may need surgical implantation of a pacemaker. A pacemaker is a small electrical device implanted in the body with wires going to the heart to regulate the heartbeat. It fires electrical impulses that help the heart return to the proper rhythm and speed. So it essentially takes over the work of sending an electrical charge through the different parts of the heart. It kind of overrides the heart's own electrical impulses. And if you click on this link, you'll see a short video with more details about pacemakers.
Your heart has its own natural pacemaker called the sinus node. It sends out regular electrical impulses that cause the chambers of your heart to contract and produce a heartbeat. If your sinus node doesn't work properly because of a heart condition, your doctor might recommend a pacemaker, a small implanted device that sends electrical impulses to keep your heartbeat regular. These impulses do not shock the heart, they simply do the job of the sinus node. Some pacemakers only function when they're needed, whereas others generate impulses all of the time. Thanks to your support, our research transformed the old bulky pacemaker design into a small, sophisticated device that is the size of a small matchbox and weighs about the same as 2 AA batteries. Julie is about to get a pacemaker fitted and is understandably nervous about the whole thing. She is given a local anaesthetic, so is awake during the procedure and notices some mild discomfort, but feels relaxed throughout. It takes around an hour, where the pacemaker is inserted under her collarbone and leads are placed into her heart through a vein. After being reviewed by a doctor, Julie is able to go home the same day as her procedure. For the first 6 weeks after having the pacemaker fitted, Julie has to take extra care with her arm and shoulder on that side, but it's not long until she can start most of her normal physical activities again. Julie isn't able to drive for a little while after getting it fitted, and has to let her car insurer and the DVLA know that she has a pacemaker. At Julie's regular clinical appointments, her doctor makes any tweaks necessary as her pacemaker stores information about her heart rhythms. Julie notices some twitching when her pacemaker first sends electrical impulses, so she tells her pacemaker clinic, and they are able to change the settings to stop this happening. Julie has to be aware that magnets can interfere with a pacemaker, so she needs to make sure that she keeps any electronic devices, like her mobile phone, in a pocket away from her pacemaker. Julie also has to stand away from induction hobs and avoid travelators. And whilst it very rarely causes problems, Julie shows her pacemaker ID card to the staff before she goes through airport security. She carries her ID card with her at all times in case of emergency. Thanks to her pacemaker, Julie can continue with her life as normal, reassured that it's there if her heart needs it. For more information on living with a pacemaker, visit bhf.org.uk. BHF. Beat heartbreak from heart and circulatory diseases. Beat heartbreak forever.
Treatment plan for somebody with AFib should include 3 different goals. One is to restore the heart's normal rhythm. One is to slow the heart rate down so it's in the normal range. And the third is to prevent blood clots from forming. It's important to know that people who have AFib can live normal, active lives once the AFib is treated. And for some people, treatment can restore normal heart rhythms. For people who have long-term AFib, treatment can help control symptoms and prevent problems. And the treatment may include lifestyle changes as well as medicine, medical devices, and surgery. What's the role of community health workers in working with people with AFib? Well, remember that this is a pretty complicated treatment for a lot of people. They often end up getting on more than one medication. Sometimes there's a lot of follow-up, lab tests, all kinds of things. So it's important for community health workers to support people with AFib in coping and in stress reduction. They should teach people the signs of AFib and the need to call their doctor right away if they get any of those signs. Teach people with AFib how to take their pulse and to take it regularly. If it starts really racing, again, they should talk to their doctor. They should teach people the link between AFib and stroke and the need to control AFib and take the medication as ordered in order to reduce the risk of stroke. They should educate people on healthier lifestyles, so diet, physical activity, all the same kinds of changes that they should make to have a healthy heart in general. And to lower the risk of stroke. So quit smoking, drink alcohol at only a moderate level, all of those same lifestyle changes. You want to educate people to check with the pharmacist before using any herbal products, any multivitamins, or over-the-counter medicines. This is actually really important. Because you want them not to take anything else that has vitamin K in it that can interfere with the work of the blood thinners. Some herbal products like chamomile and ginkgo biloba may increase the effect of the blood thinning medicine, and so then people may be more likely to bleed or bruise. So again, they want to talk to the pharmacist or their doctor before they take anything. And then other herbal products like green tea and St. John's wort can decrease the effect of the blood thinning medicine, which again could mean that it's not going to work to prevent stroke. Community health workers should also help people with AFib have an emergency plan in place in case it's needed. That's both for if their AFib really gets out of control and they get very short of breath, for instance, or very dizzy. It's also in case it causes a stroke. And you should link people with community support resources. Community health workers can also help people with AFib by helping them take their medication correctly. You can encourage people to take their medicines exactly as prescribed by their doctor, explain why they may need to be on several different medicines, and give them tips for remembering to take their medications. You may also need to offer them strategies like pill boxes or pharmacy-filled bubble sheets if needed, especially if somebody is taking, multiple medicines and they have to be taken at different times of the day. It can become very confusing, particularly for elderly people. So you might help them set up a system like that just to help make it simpler for them. You might work with your clients to ask their doctor some of these questions. How serious is my AFib? So for some people, the AFib comes and goes on its own and doesn't really cause any long-term problems. Other people need to be on pretty intensive medicine, maybe even surgery for it. Do I have other health concerns that may increase my risk from the AFib? What are my medication options? Should I be on medication? What should I expect? What if I don't take it? So what's the risk of not taking it or not taking it regularly? In what ways does AFib affect my health risks? Are there other treatment options available? What lifestyle changes do I need to make? What are my treatment goals? What should I expect to see? How will I observe progress? And also, what kind of follow-up will I need? This is a great resource that you can share with your patients who have AFib. It's an online community where people can get support and tips from other people who have AFib. So www.myafibexperience.org. Now you can explain stroke risk from AFib, become familiar with procedures for diagnosing and treating AFib, identify community health worker activities that create care connections for people with a history of AFib. Don't forget to go to the Google Classroom to complete the assessment for Module 4 AFib, and congratulations on completing Module 4. Your next module, Module 5, is about high blood pressure.